Decreasing central line-associated bloodstream infections.
So our PICO question was, does the use of Curo's disinfectant caps on central lines decrease infection rates versus alcohol prep wipes among hospitalized patients on a med-surg floor?
Background information. Central line associated bloodstream infections are the result of organisms entering the bloodstream through a central line. CLABSIs are associated with an increased length of time in a hospital, increased cost of treatment, and increased mortality. CLABSIs are preventable with proper sanitizing techniques, however, manually disinfecting can be time consuming and adherence may not always be followed. This project was created to explore if the use of disinfectant caps on central lines is a better alternative to manually disinfecting a central line.
Our first article is Antiseptic Barrier Cap Effective in Reducing Central Line-Associated Bloodstream Infections. It is a systematic review and meta-analysis. The purpose of the study is to compare disinfectant caps versus manual disinfection on the incidence of CLABSIs. The methods used in this article were searching published articles that were conducted in a hospital setting and reported numbers of incidents of CLABSIs with both disinfectant caps and manual disinfecting. The results of the research in this article came by filtering through articles for duplicates and subject matter. 7 articles were included in the meta-analysis. These 7 articles showed the use of disinfectant caps were effective in reducing CLABSIs with a significant p-value. The use of disinfectant caps on central lines helps to reduce the number of CLABSIs and should be included in maintaining all central lines. Our second article is Educational Interventions Alone and Combined with Port Protector Reduce the Rate of Central Venous Catheter Infections and Colonizations in a Respiratory Semi-Intensive Care Unit. This is a single-center prospective study. CLABSIs cause as many as 28,000 deaths a year. 60 to 70% of CLABSIs are preventable with proper site care, and that is the purpose of this study. The methods used were conducting a study over 18 months, 9 months of observation versus 9 months of intervention in a respiratory intensive care unit. Participants were split into 2 groups, education intervention alone versus education intervention plus the use of disinfectant caps. The results of this study, during the observation period, 87 lines were included with an infection rate of 8.4 out of 1,000. During the intervention period, the education-only group had a CLABSI rate of 1.4 over 1,000. The education and disinfectant cap group had 0 CLABSIs reported. And in conclusion, education is important when dealing with central lines. However, when used with disinfectant caps, CLABSIs are decreased even more.
The third article is Analyzing the Effect of Universal IV Needleless Connector Disinfectant Caps on Rate and Type of CLABSI and Estimated Associated CLABSI Costs in a Large Tertiary Care Center. This was a quasi-experimental study. They used a 430-bed Trauma 1 center. Existing standard central line policy and procedures were followed, along with implementing the Luerlock disinfectant cap with 70% alcohol inside on all intravenous needle connectors and patients with central and peripheral lines. Compliance was monitored weekly, and a linear model using a Poisson distribution was used to determine if there was a significant relationship between CLABSI and disinfectant cap use. Impact on costs were also examined. The results indicated that the rate of patient infections decreased by greater than 40% with the use of the disinfectant caps, and estimated CLABSI costs for hospitals they were able to save annually $282,840. In conclusion, the disinfectant caps used on the IV needleless connectors in combination with existing standard central line procedures decreased CLABSI incidence and associated costs.
So Article 4 was Port Protectors in Clinical Practice and Audit. So this was an experimental study, and it was an audit where port protectors were used instead of disinfection wipes to monitor infection rates and staff compliance. It was conducted on 4 wards, a surgical ward, oncology, critical care, and an elderly acute care unit for 6 months. The port protector was used on 1,094 patients who had vascular access devices and covered all needle-free devices, including arterial VATs, peripheral IV catheters, and central venous catheters. They also used slogans to support compliance, such as all catheters, all ports, all the time, and green means clean. And posters were also used to emphasize this by Infection Prevention and Control Team. The results showed that anonymous benchmarking audit of scrub the hub techniques showed that 54% of staff were only cleaning for 10 seconds or less, and they recommend 15 seconds of scrubbing the hub plus another 30 seconds to let it dry. So the results of the audits showed bad related bacteremia rates decreased by 69% from 26 cases before the study to 8 when staff compliance with Curo's placement onto BADS was 80% or more. So in conclusion, port protectors led to more compliance than there was with standard scrub the hub disinfection techniques. It was also easier to monitor compliance using the port protector, for they are bright green, and if a needle-free device did not have a port protector on during the time of the audit, it was recorded as a non-compliance. Port protectors also saved approximately 45 seconds per disinfection process if you take into calculation the 15-second scrub and 30 seconds you're supposed to wait for it to then dry. Staff liked the visibility of the caps for their own self-auditing and how easy the caps were to use, and the 1,094 patients felt the port protectors gave them a sense of partnership and empowerment in their care.
Recommendations. The use of Curo's disinfectant caps should be continued to be used on central lines. Education on the importance of the disinfectant caps should be given in order to prevent CLABSIs, which in turn decreases patient infection rates, mortality, and hospital costs.